afternoon, everybody. Can you hear me? Yeah. My name is Carolyn Mendez-Blanc, and I'm an assistant professor in the college. And it's my pleasure to introduce today's speaker for the seminar series, Professor Steve Wallace. And Steve Wallace is professor and chair of the Department of Community Health Sciences at the UCLA Fielding School of Public Health and associate director at the UCLA Center for Health Policy Research. Professor Wallace is a leading scholar nationally in the area of aging in communities of color, including older Latinos, American Indians, Alaska Natives, Asian Pacific Islander Americans, and African Americans. So over the past 25 years, Professor Wallace has published research on access to long-term care by diverse elderly. And I'm going to veer away from the script because I've known Steve for so long, so it's kind of hard for me to actually read this. So Steve does a lot of work in health policy and aging, and looking at particularly among vulnerable populations of older adults. He also has done a lot of work in immigrant health. And so it's a pleasure for me to have him here. Because besides being a colleague of mine, he's been my mentor and been a friend for almost 20 years. So please welcome Dr. Steve Wallace, and his talk today will be on economic security, or should I say, insecurity among older adults.
Thank you, Karen. So I don't hear me booming. I assume the mic is working? Yes. Okay. Great. So thank you all. Thanks to Carolyn and to the college for inviting me up here. It's nice to have a little water after being in the parched desert of Los Angeles. I've been working on issues of economic security in this particular issue of the Elder Index for probably 7 or 8 years. And I thought I'd just give you a little brief background about how I got involved in it before I get into the talk itself. I teach health policy and aging. I teach minority aging, a lot of different topics, and I never had on my syllabus a discussion of the poverty level, but always when we would be talking about how policies are arranged in the United States or looking at disparities in income among different groups, you always end up falling back on the poverty level. And I would invariably end up with a rant, which would be about a 15 or 20 minute sort of sidebar in some class, never scheduled, on how we came about measuring poverty in the United States and how crazy it is. And I'll give you that rant in a minute. And then I was approached by an organization in Oakland, which was part of a national movement, to actually come up with an alternative way to design and disseminate an evidence-based way of looking at economic security for older adults and trying to move the conversation away from deprivation to economic security. And in aging studies, we often talk about aging with dignity, trying to design services and programs that really respect the dignity of older adults. And the Elder Economic Security Initiative really is trying to move the conversation to what's a minimum decent standard of living away from what is an inadequate measure. So I've been working on this for a number of years, and so what I'm going to do today is to provide you my 10-minute discussion of how we got to where we are in the way we measure poverty, why it's inadequate, even though it's embedded in all of the health policies and aging policies that we have in the country, what alternative is that's being promoted around the country now, and then the impact of that, and both the impact on the ground and some of the policy implications. And so really taking our discussion of poverty and economic security from the last century and into the current century. So where did we get our measure of poverty? Franklin Delano Roosevelt in the 1930s in his second inaugural said, reflected on the Depression in the United States. And in the 1930s, we had no way to measure poverty, so it was impressionistic. And the best he could do, there were lots of people unemployed. We did a census every 10 years. This was 1937, so the last census had been 1930, before the Depression had really hit. So they really didn't have any clean indicators other than a lot of people were being distressed. And so he said in his inaugural, in trying to emphasize the need for the country to address poverty, he said, I see 1/3 of a nation ill-housed, ill-clad, and ill-nourished. And that was as precise as we got for poverty, was the sort of impression of people not doing well. I think it's also telling that he went on to say The test of our progress is not whether we add more to the abundance of those who have much, it is whether we provide enough for those who have too little. So I think those words still ring true today. So through the 1930s, 40s, even 50s, we talked about people who didn't have enough money, people who were struggling, people who didn't have housing, but there was no objective measure of poverty. Along comes, who's this man?
Johnson.
Lyndon Johnson, elected president in 1964, and he decided to declare a war on poverty. In his 1964 State of the Union address, he announced that the country was the wealthiest country in the world, but we still had a shocking number of people who were poor, and that he was going to propose a series of programs that would eliminate poverty in the United States. But how do you know you've eliminated it if you have no way to measure it? So it may seem simple now, but back then there was no yardstick that you could use to say, are we making progress in our war on poverty? And so they had to come up with a standard national measure of poverty. The political considerations were that the number had to generate enough poor people that you could bring it down. Right? So if you said only 2% of the American population is poor, you have to declare a war on it, there's a floor effect. You can't go any further. On the other hand, during this period, we were also in a ideological competition with the Soviet Union, which was saying that theirs was the best economic system. And so if you said half or two-thirds of the Americans were poor, that would look really bad. So it had to be a number that was not too high, not too cold, a little bit like the Three Bears, right? And so what they did is they came up with a menu of different ways to measure poverty. And they chose one that ended up with a reasonable in terms of policy numbers, total number of persons in poverty. So what they came up with was developed by an economist in the Social Security Administration. And in the 1960s, we didn't have a lot of information. We are swimming in information now about the population. But at that point, we didn't have much. What they had was a 1955 Department of Agriculture survey that showed that the average American family spends about one-third of their after-tax income on food. So that was, so families spend about a third on food. In 1964, 65, when they were developing this, they didn't have an index that measured all products. So they said, well, if the average family spends about a third on food, and we can come up with the cost of food, then we can multiply that by 3, right? So a third. So what they did is the Department of Agriculture had come up with 4 different baskets. One of which was an emergency food basket, which was designed for like a post-Katrina, when everything's fallen apart and food is hard to get and you're just getting by. How much do you need to buy food on a short-term basis? It was not designed for a lifelong food pattern. Then there was a low-cost food basket, which was a slightly better quality of food. There was, and then 2 more above that. And so what they did is they sort of worked backwards. They said, if we pick the low-cost food basket and multiply it by 3, how much money is that? And then given what we know about the population in 1960, given the census data, how many people would be poor? And that was too many. So then they pushed it down and went to the emergency food basket, which was the lowest USDA food basket. And so that was what the poverty line was determined by. It was 3 times the amount of money to buy basically rice and beans forever. Now, so that was, I like to show this. Who's a car aficionado? What kind of car is this?
Edsel.
It's an Edsel. So what's famous about the Edsel? It was a dog. So I put this up here advisedly. Ford, I believe, produced it with a lot of fanfare, and it was considered the biggest flop in automotive history. But that was the same era. So the poverty line that we use today was developed in the 1960s using the same data as was used to create this wonderful car that was a flop. So this is where we're starting, is with an Edsel measure. So what are some of the problems today? There's 3 stories in this chart. So if in 1955 the average family spent a third of their income on food, do we spend more or less on food today? Less, a lot less. So this is just core expenditures. This doesn't include a lot of discretionary expenditures. So even these are slightly overstatements, but for the under 50 population, it's 12%, and even the over 65% population is 17%. So we spend a lot less money on food. The price of food has gone down. The standard of living has gone up, so we don't have to spend as much on food. So if you think about 3 times this very minimal basket of food, you're only looking at a portion of the total. What's the largest expenditure now that most people face as part of their overall? Shelter, housing, right? That should probably be no surprise to any of you. As the core expenses of these 4 sort of key expenses together, the under 50 population is about half of total expenses for those core items. For the elderly, it's 45%. So we've moved from a world where food was a major expense to a world where housing is a major expense. And then the third story here is something that was never considered in the 1950s and still isn't considered, is healthcare costs. So for the under 50 population, it's modest. It's about 7% of core expenses. But for older adults, it's almost 1 out of every $5 of their core spending goes for healthcare. That's a surprise to many people because they say, but don't older adults all have Medicare? But Medicare, you have to pay for Part B. Medicare, there's deductibles, there's co-payments. There are certain services that are not covered. And even if you've got an HMO, you can face large out-of-pocket expenses, particularly if you need long-term care, if you become disabled and need help at home. Even worse if you end up in a nursing home. So the poverty line, was too low to start with. So even Molly Orshansky, who developed it, wrote in 1965 that it was probably too low. Using the low-cost food plan, probably underestimated in 1965 what it cost, but it was a defensible because it was low. You couldn't argue that it should be lower. And today that's even worse. Housing has taken over, and for older adults, medical care. So these are all components of necessary consumption, not discretionary consumption, but necessary consumption that are no longer that aren't taken into account in the poverty line. So the other issue with the poverty line, the federal poverty line, is in the 1960s, the only data they had was national data. So poverty in New York and in Portland and in Ames, Iowa is all the same amount of money. If housing is the driver of a lot of the expenses that people face, it only makes sense to think about housing costs, right, at a regional level. And we all know that the cost of living is different in different areas of the country. And in particular, you can see the cost of a one-bedroom apartment in different cities in the United States. So this is the most recent data. HUD is the Federal Housing and Urban Development Department. And they have a thing they call fair market rents, FMR. And fair market rents are what HUD will pay Section 8 subsidies up to that amount. It's actually calculated at the 40th percentile of apartments available for rent in the area. So it's not the nicest apartments, it's not the best apartments, and it's an amount that the government will actually pay you subsidies to live in. So it's a pretty modest amount. San Francisco, thanks to the internet electronics boom, has displaced New York now as the highest cost for a one-bedroom apartment in the country. So you can see even within a state. So Los Angeles is 1/3 less than San Francisco. Portland is about half of San Francisco. And Corvallis is less yet, but you can go lower. You can go down to Des Moines. So the variation between Des Moines and San Francisco is a factor of 3 in the cost of housing, just right there. So one of the key problems with the federal poverty level is that it is the same amount in every single city and county in the country. As a sideline, how many of you are familiar with the Affordable Care Act? Anybody ever heard of it? Okay. So they offer subsidies for people who have low and modest incomes to buy private health insurance. How do they calculate, what is the subsidy tied to? Maybe a bad question. So How much money can you make and still get a subsidy for private insurance? I know at least one person in this audience knows.
Is it big? 400% of the poverty line?
Okay, so 400% of the poverty line, so it's a graduated subsidy that goes to zero at 400% of the poverty line. But wait a minute, if you live in San Francisco, is 400% of the poverty line a lot of money compared to if you live in Des Moines, Iowa? I'll show you some data. The answer is no. But the subsidy is the same everywhere. So it's just another recent example of how poverty, the same number, so you can adjust the numbers. So 400 sounds like a lot. It isn't necessarily, but it doesn't buy you the same in different parts of the country. And so that's important. The other issue that's important is knowing the type of housing that people have. So when you look at low-income older adults, so this is just for older adults whose income is below 200% of poverty. What's interesting is that oftentimes we encountered that in working with people in the East Coast. They said, well, most older adults own their home without a mortgage. Well, and that's, even among low-income older adults for non-Hispanic whites, that's true. The majority, 55%, own their homes and don't pay a mortgage. So you still have taxes and upkeep and utilities. So it's not free, but it's stable, it's predictable, and it's a lot lower. When you look at Latinos and African Americans who are more likely to be in cities, they're disproportionately renters. So if you don't break out not only what city do they live in, but are they renters or owners, then once again you're going to be looking at the need for income that's very different. And if you use one size fits all, you actually disproportionately underestimate the cost of living for Latinos and African Americans. So another reason, another dimension to think about. So where do people live? What are their housing types? And so what we've done is we've put together an alternative. It's called the Elder Economic Security Standard Index, which is a mouthful. We call it the Elder Index for short. And we like to call it an evidence-based measure of economic security for older adults. So you could maybe call the federal poverty line evidence-based because it used evidence from the 1950s. But we're in 2014, for heaven's sakes. So what we look at are actual costs, housing costs across the three types I showed you. So the cost for somebody who's an owner with a mortgage, an owner without a mortgage, and a renter. We look at the actual healthcare costs, which the poverty line has never really incorporated. We look at food, but only food consumed at home. So, when we were developing this, we had a lot of back and forth over what expenses to include. And the argument was always to go on the low side. So, but what if people eat out? I mean, can't you have like a McDonald's or a Wendy's or something at the farmer's market once a month? No, this is just food at home. Local transportation. So once again, I argued, well, shouldn't you, like people when they're elderly, they might have a sister who dies across the country or want to go to the wedding of a nephew or... No, so we look only at local transportation costs. So I'm telling you this so that when you see the numbers, you realize that these really are basic costs of living. They're not a middle class, let's go to Europe for the summer kind of living. And then miscellaneous, and we had a lot of discussions around that. So basic telephone, clothing, home repairs, all gets included in miscellaneous. I argued we should include cable service. Why would that be? I lost, by the way. But what would be an argument for including the cost of cable service for older adults?
It's their only source of or one of their sources of information.
Okay, for a lot of older adults, especially single older adults who are living alone, that's oftentimes their only tie to the outside world. 90 to 95% of Americans have televisions, and 80% of people with televisions have cable or satellite. So very few people anymore actually get their TV signal off the air. Almost everybody has some kind of service. So I lost, so this does not include cable TV, right? So once again, just to emphasize, these are the basic costs of living. Okay. And then we counted these at the county level. So one of the biggest concerns over the federal poverty line is that it's one number for the entire country. we were able to get county level data, and so we adjusted county by county. So here's what it looks like. I took City of Los Angeles, where I live, and the Oregon state average. So Portland's a little different than Corvallis, which is a little different than other parts in the state. This gives you a general overview. Oops, except that I'm cutting off the bottom here. Sorry. So if you look at the renter for one bedroom, in Los Angeles, the fair market rate is $1,085 in 2010. I use 2010 data because the national organization that calculated the numbers for Oregon had it for 2010. Okay. And the Oregon average is a little bit less. But you can see the other costs are pretty similar, right? So food is pretty similar. Transportation is similar. Now, this is an interesting line, healthcare. So in California, in counties with a high managed care penetration, we use the Medicare Advantage cost, which means that in Los Angeles City and County, you can sign up for a Kaiser Medicare Advantage health plan, which is very comprehensive, reduces your out-of-pocket costs, has extra benefits, and so forth. And for all those extra goodies, you pay, anybody know? $0. You can sign up for Medicare Advantage. Kaiser Medicare Advantage plan costs you nothing in Los Angeles. Versus in places without high managed care penetration, we include the cost for a Medigap policy. So I mentioned that Medicare has high out-of-pocket, both copayments and deductibles. So Medigap policies typically cover those. So it gives you a predictable versus a spike in your costs. And we also include a Medicare Part D prescription drug policy. So that's why when you look at the cost of health care, on average in Oregon, it's twice what it is in LA. And that's because you're buying supplements to Medicare fee-for-service. In Los Angeles, you can get top quality care with extra goodies for nothing more. And so this actually ends up in California evening out a lot of the variation in housing costs, because in places where housing is expensive, it tends to be dense city areas where you can get a low-cost or no-cost Advantage plan. And in other areas, you end up having to pay a lot more out-of-pocket costs for supplemental policies. Then miscellaneous, so the total per month comes to, just in California, just over $2,000. And in Oregon, which you can't see, it's $1,890. So it's really only about $100 a month difference between the cost for basic standard of living, which at first you'd say, really? Between Los Angeles and Oregon on average? And a lot of that is because of the equalizing influence of the cost of healthcare. So if we didn't look at healthcare, we would say Oregon's a bargain. But when you add in healthcare, it's less of a bargain for the average senior. Now, does anybody, let's see, no, I haven't given you the poverty level yet. Okay. So the federal poverty level in 2010 was, sorry, you can't see that, $10,830. So call it $11,000. So that means that for a single person, and it also doesn't matter by age, right? So it's $11,000 whether you're 20 or 80. It's supposed to buy all of your goods and services for a year. Now, do you remember what I said the cost of an apartment was in Los Angeles? How much, more or less?
It was over 1,000.
It was 1,000. So that equals, you don't have to be like a biostatistician, that's $12,000 a year. You cannot rent an apartment in Los Angeles for what the federal government says is an allowable amount with the amount of money that the government says is the federal poverty line. So clearly, you don't need to do any fancy statistics or random assignment of people to an experiment. It's clearly an inadequate amount for the cost of living in Los Angeles. And, as you may remember, so the cost of housing was less in Oregon, but all added up, it was similar in Oregon. So if it's dreadfully inadequate in California, so these are the Oregon amounts, so $22,000. So the federal poverty line is about half of what it costs to pay for basic expenses for an older adult in Oregon. In other words, you would need to use 200% of the federal poverty line to get a decent minimum standard of living for an older adult in Oregon. For somebody who's renting, if you own your home, you're still shy, right? So it's 19.5, which is still substantially more than what the federal. So even in the best circumstance, in Oregon, on average, if you own your home, you're just paying for utilities and insurance and so forth. You're still not making it. And then if you're unfortunate and you bought recently before you retired and you're still paying your mortgage, then you're looking at a $30,000 a year. So often use the renter as sort of the benchmark, because even if you said, okay, I can't afford this home anymore, I'm going to sell it, you'd still have to be here, right? So you can't really go lower than here unless you've been in the same house for 20 or 30 years. So that shows the gap between the standard of living, money you need for a decent standard of living and what the federal government says. It gets even worse when you look at SSI, SSP. Anybody know what SSI is? Supplemental Security Income. So this is a program for seniors who don't have much money. And if your income is below, you can't see that there, it's $7,700 a year. So some seniors don't get enough Social Security for a variety of reasons. They're in and out of the labor force, they've worked in the informal economy, a whole variety of reasons. They have very low Social Security or none. So supplemental security income is for the aged, blind, and disabled. On the aged part, it will bring you up to, in Oregon, call it $7,800. Okay? So is that enough to live on? No, it doesn't even bring you up to the poverty line, let alone up to what you need for a minimum decent standard of living. So in California, our SSI level is about $1,000 more, which is still below the federal poverty line and still grossly inadequate for a very basic standard of living. And then if you look at, we've been doing the Elder Index since 2007, so this is California data. But if you look at the trends, the trends are that you're needing an increasing amount, especially if you're a renter. And 2013, which we'll do next year with the housing market tightening up, will get even higher. So this shows you the federal poverty line, which has been relatively flat, versus the cost of living for seniors that they actually experience. So anybody know how the poverty line, how they determine what it should be every year? So it's going up, just very slowly compared to the actual cost of living. So how's the federal poverty line adjusted? So what they do is they take this amount, and they look at the Consumer Price Index. Consumer Price Index is a market basket of goods. They take urban consumers, but it's national. This is a national number, so they take national data. But it's an average market basket for a family. It does not overweight healthcare, which happens to be, until recently, a very fast-growing part of elder expenses. And it includes sort of everything the average family, not an older adult, would consume. And so inflation in the last 4, 6, 8 years has been relatively low overall. So, 2007, the federal poverty line was 10,210. 4 years later, it's 2,890. Not a big jump. In contrast, actual measured expenses in California for those core expenses that seniors depend on has gone up much more significantly. It's gone up $2,000. And so the gap between the federal poverty line and what seniors need to survive is actually growing. Okay. Excuse me as I go into policy wonk land for a minute. There's a proposal that's been pushed. The Obama administration has even said they're willing to go along if it's the price they need to pay to get compromise with Republicans on other bills, to change the way we do inflation adjustment. And this would have implications for Social Security, because Social Security goes up every year, the benefits based on the Consumer Price Index. The poverty line is adjusted every year based on the Consumer Price Index. So the way the Consumer Price Index is calculated actually has implications just like the poverty line, for a lot of different programs, including the poverty line. So, to try not to get too technical, the chained CPI, which is like most like this line, assumes that people change their consumption behavior in a particular set of ways. So the current CPI, when the cost of Rome apples goes up, they assume you'll buy Golden Delicious instead. When the price of bananas goes up, they assume you'll buy pears instead. So it assumes some flexibility within a category. The chain CPI says, well, if the price of beef goes up too much, you'll go from steaks to hamburger. And then you'll go from hamburger to chicken. And then you'll go from chicken to what's below chicken?
Beans.
Yeah, cat food. It's it's meat still, right? Spam. So it assumes a much broader flexibility in substitution of products. And what's driving the chain CPI are not economists who like to sit around and come up with lots of interesting equations, but really see policymakers who are looking for ways to slowly cut benefits without actually cutting benefits, without coming out and saying we're cutting benefits. So what this shows is, this is the average value of Social Security benefits currently. So if you adjust for inflation currently, the idea is, using current measures, $15,000 Social Security benefit now in 30 years is worth $15,000, right? So it's supposed to keep the purchasing power relatively flat. But this is assuming older adults spend on the market basket that's used to calculate the CPI. They have an alternative consumer price index called the Consumer Price Index for the Elderly, which looks at what elderly people spend money on. So it's much more like the Elder Index. So it's got a heavier weight on health care. It's got a lower weight on some entertainment expenses. And it's got a heavier weight on housing. And the projections are, is if you use the CPI for the elderly instead of the standard CPI, in 30 years, you would have to be making $15,000 instead of $14,000. So this is just one illustration of how the expenses of older adults is actually higher than the expenses of the general population. And this is the equivalent of the chained CPI, which says that the buying power that started at $15,000 would end up at $13,500, assuming that this is the standard of it. But what it also shows is, since this is the expenses that older adults have, that the way we currently adjust for inflation by using this broad market basket already isn't accounting for it, so it's 6% off. And moving to the chain CPI would cut it another 8%. So that's a little sidelight into being conscious of the fact that older adults are not simply middle-aged adults with gray hair, any more than children are short-statured middle-aged adults. So the consumption patterns are different, the needs are different, and so maintaining a minimum decent standard of living actually requires a different metric. And the policy discussions, instead of looking towards adequacy, are actually looking towards reducing. And I guarantee you will hear this probably for the next 3 to 5 years. So when you hear chained CPI, you can translate that to cutting the amount of money that low-income older adults get. Okay. So the elder index, actually, what we've calculated to date are for older adults living alone, for older couples. And then we've been going back. We've looked at the costs for grandparents caring for grandchildren without a parent involved. So if you're a grandparent and your child, for some reason, can no longer take care of their children and they move in with you, what does it cost? This actually is a relatively small number in California. There's about 4 million elderly. About 100,000 are the sole caregivers of their grandchildren. But that's a group that has a very high level of interest in policymakers, and so when we released those numbers, there was a lot of attention to that, a lot of advocacy groups involved with that group. Another one that we released in February was baby boomers living with elderly parents. And so this is adults who may or may not have families, but typically don't have children, who then move in with their older parents. The image often of the elderly is, if they're living with their children, it's because the older adult is sick and disabled and needs help, and so they move in with their kids so that they can be taken care of. But there's actually about 400,000 older adults in California who are helping their adult children out by providing housing and financing and co-residence in that way. And this is in part a legacy of the recession. So the housing collapse in California meant that at one point a quarter of all people, of all adults, middle-aged adults who own their homes, owed more for the home than the house was worth, so it was underwater. The unemployment rate went up, and actually when you reach age 50, the chance of getting reemployed declines dramatically. So it's much easier as a young college student, even though it may not sound like it now, but it's actually easier for a young college student to get a job than somebody with the same credentials who's in their 50s. So that actually generated a surprising amount of interest, and there's a front page article in the LA Times and a lot of other media on that. So the next ones we're calculating now are the opposite, which is more stereotypical. Older adults move in with their kids, and then we'll calculate basically everybody else. So right now the elder index really is for a subset of older adults, about 2/3 of older adults who are living alone or living just with their spouse, and we're creating an entire panorama for that. So what's been the response to this? We did a survey of California legislative staff about 2 years ago, and that's the policy brief that I handed out, and asked them, for the legislators who had a focus, who had a legislative interest in low-income populations, what were the metrics that they used? What kind of information did they look at? And not a great surprise, but about 80% used the federal poverty line. So if I'm interested in low-income people, what do I use? Well, I use the official federal definition of poverty. About 2/3 were interested in unemployment, healthcare costs, unemployment, healthcare costs, food affordability, and the minority was transportation costs. So most of the people in the legislature, most policymakers rely on the federal poverty line, which I've just shown you ad nauseum is inadequate. So then we asked them, it was a little bit sneaky, we said, well, what would be your ideal metric for identifying people who were financially insecure? And 2/3, so we offered them 4 alternatives. 2/3 said, well, I really want something based on current costs. Right? What does it actually cost today? Not 1950, today. County level data would be ideal. This surprised us a little bit because we assumed they would want legislative district data, but most people actually don't. If I asked you what your legislative district was, would you be able to tell me? No, but you can tell me your county. So they actually were more interested in county than legislative district. And they wanted all basic living expenses. And their number 2 was not on costs, not on what would it cost if you needed an apartment, but what are people actually spending, and some basic needs. And so there's actually the Census Bureau has a experimental poverty line that they've come up with in the last couple of years called the Supplemental Poverty Line, SPM. That doesn't look on what it costs to own a house. It looks at what are people actually spending on housing. It doesn't look on what does it cost to buy food. They look at what are people actually spending. So there's a distinction, because if you have no money, can you spend more?
Nope.
So the supplemental poverty measure is actually sensitive to what is the distribution of income in an area versus what is the distribution of the cost of living. And it looks at a subset of needs that we look at in ours. But that was their number 2. Any idea what out of the 4 scenarios was almost universally last? This is not a trick question. A measure based on 1950s standard of living, that's the same for the whole country, that only accounts for the cost of food. Does that sound familiar? That was their last, if they were going to ask for what would be most useful for them, that was the least useful. But what do they use? But that's what they use. So why do you think that is? Is that like, are legislators just dumb? Don't answer that question. Why would they be? What would be a logical reason for using that? I mean, most legislators that we talk to, because they specialize in poverty issues, were really interested. They were concerned. They wanted to do things to improve the lives of low-income people in the state. They were trying to make programs more effective. Why would they rely on the federal poverty line?
It's a common language there. It's a common metric.
Okay, so it's a common line. It's something everybody knows. When you say poverty, everybody knows the same line. Any other reasons?
It's what the federal programs are based on. So if you're going to work on a state level, you need to know what's being offered federally.
Exactly. So as I said, the Affordable Care Act uses federal poverty line as part of their eligibility. So it's great if you want to use something else, but when it comes down to actually coordinating your programs with federal programs, reporting information to the federal government, it all requires the federal poverty line. Any other reasons?
It's there.
It's there. They talked about being able to compare to other states. So now the elder index actually is calculated at every state now. It wasn't when we did the survey. And there's a time trend. You can look over the last 10 years. So there were a lot of kind of practical reasons why they relied on the federal poverty line. And we had one legislative aide who also said, well, you know, off the record, so I'm not using their name, to be quite honest, legislators are lazy. They don't want to have to struggle with trying to explain and understand different types of measures. So this is the easy one. Even though it's not what they want, even though it's not adequate, it's there. So it's not that they wouldn't use it. It's not that they wouldn't like something better. It's just it's part of the going with the flow. So there's a big institutional inertia there. Nevertheless, we've had some impact. So we've been in the front page of the LA Times a number of times. This was a 2010 article that talked about the federal poverty line in general. This was in rural areas using the Elder Index to look at older adults who are struggling to get by. And this was about 2-3 weeks ago, the latest policy brief that I mentioned about baby boomers moving back home caught the attention of a reporter at the LA Times, did a page one story. When you're on page one of a major newspaper, you then get calls from radio stations and television stations and other media. So this has gotten quite a bit of discussion around the problems of making ends meet when you're a low-income senior. In California, we worked for a number of years, and a bill was finally passed in 2011 that requires the State Department on Aging to use the Elder Index in planning for aging services in California. Now, they still have to report data to the federal government using the federal poverty line, but in talking about where pockets of needs are in terms of prioritizing services to seniors, they're now required by state law to include the Elder Index in consideration of where their county is for a minimum decent standard of living. And the counties actually appreciate this. So I showed you the high costs of rentals in San Francisco. They recently established a program funded by the county to help with home and community-based care. So some in-home services to help older adults stay at home who have disabilities. And when they went to their board of supervisors, the county health department was arguing that the eligibility level should be at 300% of poverty. One of the problems conceptually with using poverty is when you say, wow, 300%, that's a really high eligibility level. Isn't this like middle class folks? And then they trotted out the Elder Index, and they said, well, the cost of living in San Francisco for minimum standards, including housing, well, look, housing is $1,500 a month. And then you add food, and then you add a little transportation and health care, and 300% of poverty level is about what the Elder Index is for a renter in San Francisco. So they ended up using 300% for the eligibility level because it was easier administratively, but they justified it by using the Elder Index, and they were happy to have that. Marin, which is the wealthiest county in California, was told that they had no more need for low-income housing because they had X units and they only had, 2 or 3% under the federal poverty line, and therefore they had enough units for the older people who were poor in their county. Their housing people were very glad to get a copy of the Elder Index because it showed, no, the federal poverty line in Marin is It's not as high as San Francisco, but it's pretty close. It's about 250% of the poverty line for a renter. And therefore, the number of older adults in need of assistance with housing was actually about 4 times what it was if you only looked at the poverty level. And that provided them with the information they needed to then go and say, no, we really do need more matching funding. We need more emphasis on low-income housing in Marin. And San Diego similarly has used it. So a number of sometimes people say, oh, the legislature creates all these laws, we don't want them. But there's actually a number of the area agencies on aging, a number of aging services throughout California actually wanted to use it, and having it in state law made that even better. So to try to keep to time here, let me summarize. So the Elder Index is a better measure of economic security. What we still use today, so let's see, 1965, so 40, almost 50 years later, about a half a century later, we're still basing the poverty line on the way people lived 50 years ago, which has definitely changed. It was based on food, and it's the same number for the entire country. So this is not even last century, this is last millennium in terms of measurement standards. Versus the Elder Index actually is based on the current standard of living, is based on the most recent cost data available. It's based on the money that people need to live, not the money that they have and can spend, which differentiates it from the supplemental poverty measure. It includes the cost of health care. It looks at different housing types. It includes food, transportation, and miscellaneous. And it's geographically specific to county. You can aggregate it, so I showed you the Oregon average, but I could show you the Corvallis, whatever the county that Corvallis is in. And it's relevant to the daily lives of seniors. So the Elder Index is, for the 21st century, like our Prius here, unlike what I showed you where we came from, which it was a dog in 1959, and it's still a dog well, it's actually a collector's item now. So let's make the poverty level a collector's item and move to something a little more modern for the 21st century. The organization in Oregon that's working on the Elder Index is the Center for Public Policy in Silverton. That's their website. Wider Opportunities for Women is the National Coordinating Center organizing across the country. And the UCLA Center for Health Policy Research is where we're doing this work in California. So thank you. I'm open for questions.
So we have some time for questions for students.
I've been using mine.
Sure.
It wasn't clear whether you were including utilities in there when you did housing.
So the cost of housing includes mortgage. If you've got a mortgage, it includes utilities. It includes insurance. One thing that it doesn't include, which gets kind of hidden on the miscellaneous, is repairs. So if you own your home, you need a new roof every 20 or 30 years. That's not really actually accounted for. So it's still sort of a basic, but it does include utilities. Other questions? Comments? Yes.
So how does the Elder Index compare to the supplemental
Poverty measure.
poverty measure? Because I mean, supplemental poverty measures, adjust for some of these things in a different way.
Exactly. So the supplemental poverty measure is about halfway between the federal poverty line and the Elder Index in terms of its ability to really account for the cost of living. Couple differences. Like you say, what they do is they'll take, say, housing. They take the 33rd percentile of actual spending on housing for a renter. So it's not what do you need if you want to rent a decent house. It's what are people spending. So if you're in an economy that's got a lot of poor people and they don't have the money to spend what's necessary for decent housing, what you're doing is basically freezing them in substandard housing. It does it at the metropolitan area level instead of county. So in some areas that includes multiple counties, and counties will have different markets, so it aggregates larger market areas. So it's good that it does adjust for housing. Actually, housing is the only thing it adjusts for geographically currently. And they also use a different data set for out-of-pocket spending for healthcare. And I was actually just told last week that they look at the elder index in our healthcare measures because we use the medical expenditure survey for out-of-pocket costs and then actual costs of health plans in the area. And people's reporting about what they spend on healthcare is not necessarily as accurate. So they use us as a benchmark for their healthcare spending. And so it's better. If I had to choose the federal poverty line or the supplemental poverty measure, I wouldn't think I'd say SPM. But if I had to choose SPM or the elder index, I'd choose the elder index. There is also what they call a family index. It's the family self-sufficiency standard, which does the same thing for families. So we're really looking at the costs of older adults, particularly because of healthcare costs, which are a major one. This assumes people are retired, so there's no work costs included. A portion of Social Security is not taxed, right? So there's a set of assumptions in this which really only apply to older adults. The family standard looks at families, looks at daycare costs if you've got children, commuting costs to work, and other, right? So everybody who's 65 and over has Medicare. If you're under 65, they include the cost of health insurance, right? So the components are different, but it's the same basic idea that it's a basic minimum standard, not a deprivation or, if you live in a slum and are just getting by. So there's a sort of like a complete set now of measures that can be used. Yes?
So I just have one quick comment to the question.
Uh-huh.
My comment is, we know that the elder measure is need-based, but for me it's almost demand-based because you use actual market data.
Right.
For economists, it's better to say demand actually.
Uh-huh.
So I really appreciate your talk. So my quick question, when you calculate the elder index in healthcare, and comparing core values to LA seems to make a lot of difference. And I just wonder whether you use market average, market mean, or median for healthcare, because it's highly skewed.
Yeah, we use median.
Okay.
Yeah. So healthcare costs are not a normal distribution, right? So if it's a normal distribution, medians and means are the same. What you've got is you've got a couple people who have congestive heart failure, who are in and out of the hospital and in nursing homes and in rehab, and they may have $100,000 in healthcare costs versus the average healthy senior has $10,000 in healthcare costs. So if you've got a couple of these outliers, it really drags your averages over. And so we use median costs when we're looking at out-of-pocket costs for seniors because of that. And we also use median costs for, the other part of this is it's assuming people aren't receiving government benefits, so it's the out-of-pocket costs you would need. So some seniors get Medicaid. So if you were low enough income, and every state is different, you would qualify for Medicaid, and that would take care of a lot of your healthcare costs. This standard can be used to then say, what is the value of? For example, we have a member of our advisory board who runs a low-income senior housing project in San Diego, and he's used this to say, well, look, our residents are all on SSI. We only charge $300 a month for their apartment. So we've actually accounted for a third of their needs for a cost of living. So they can actually survive on SSI between the one meal a day we provide and the $300 housing that we offer. Their public assistance is enough to get by on. So in those instances, you might say as an outsider, oh, these people, they don't have enough money to live on, but because they get supportive housing and some food assistance, they actually do. So it can be used as a part of that part of planning process as well. Yeah.
So my question is then, clearly your data show, or what you presented indicate that there's a gap between what elders have as resources, what they're given, and what they need.
Right.
So then what do they do?
Well, so a interesting story on this. The first time the bill requiring the elder index to be used by the Department of Aging passed in California was vetoed by the governor. And we had gone through this whole legislative process, so we guaranteed there was no cost to the state for using it. UCLA would produce the data, we would disseminate it, so they wouldn't have to spend any money on calculating it, and they just had to incorporate it into their plan. So there was a zero budget impact. And the governor vetoed it, and his veto statement said, I'm vetoing this bill because it will cause cost pressures. I'd never heard that before. I was scratching my head. It's like, how can something that doesn't cost anything create cost pressures? But then somebody explained it, and it was like the light bulb went off. Well, if you do as Dr. Mendez-Lux said, and look at the gap between what we give older adults in California to survive on versus what they need, that will create a pressure to spend more money on public programs. So he vetoed it, not because it would create any more cost, but that it would show the inadequacy of state programs, and that if programs are shown to be inadequate, that somebody might want to make them more adequate. And that actually is part of the rationale behind doing this, of course, right, is to give a better view of what it actually costs to survive, so that we can, as a society, make sure people have basic needs. But I never thought that that would be like the rationale for vetoing the bill. So when it passed 3 years later, we had a different governor, and he signed it. So the gap is, what do you do? When I'm asked, what I suggest is the one policy to best address this. When you look at housing costs, so I'm in public health, right? So we think healthcare, medical care, keeping people healthy, and in counties where you're paying for a Medicare Part B, a Medicare Advantage plan, and a Medicare Supplement, healthcare costs are still really high. But what's the highest, sort of uniformly, is housing costs. So as a public health person, what I would say is the best way to make sure that low-income older adults have a decent standard of living, which then impacts their health, is to create more affordable housing. And so for a program, it would be an affordable. My public health recommendation would be to put more emphasis on affordable housing, which the United States as a country has sort of been hot and cold on, and currently is pretty cold.
Any other questions? No? Okay,
Going?
well,
Going?
Let me just, I guess I should walk up here. I can still take me. So they can see who's that voice.
There you go.
Okay, so thank you all for coming, and we really appreciate your talk. It's very interesting work, and for the doctoral students that will be staying for the second hour, why don't we take like a 5-minute break, and then we'll reconvene in the room. Thank you very much.
Great. Thank you.